Next question is, 30-year-old gentleman recently returned from an African tour. Presents with painful ulcer on his genitals. Examination shows 1 centimeter by 1 centimeter ulcerated lesion. We have an ulcer, ragged border, and yellow tinted floor. So the word yellow tinted means it's necrotic. There is also tender groin lymphadenopathy. Okay, so before reading the choices, if it's tender and there is an ulcer that doesn't mention if it's painful or not, but if the lymphadenopathy is tender, I assume the ulcer is painful as well. So I'm thinking of one of the causes of sexually transmitted genital ulcer. So I'm thinking about lymphogranuloma venereum, I'm thinking about chancroid, thinking about syphilis, or herpes. These are the most common. So the choices here are herpes simplex virus, chlamydia trachomatis, which causes lymphogranuloma venereum, or non-lymphogranuloma genital infection, Treponema pallidum, Haemophilus docreae, and Klebsiella granulomatous. So it's 1 centimeter by 1 centimeter ulcer, ragged edges, and necrotic material. So this description goes with the Haemophilus docreae. Let's see the answer. Yeah, it's Haemophilus docreae. So painful genital ulcer with a ragged border associated with tender inguinal lymphadenopathy points to chancroids. This is typical for chancroids. And this is caused by Haemophilus docreae. And you can review our video on the basic concepts in microbiology of Haemophilus docreae. Herpes simplex virus also causes painful genital ulcer. They are generally smaller and multiple. Chancroid might be multiple as well. Primary attacks are often associated with fever. Haemophilus docreae does not cause fever because it's non-invasive, so it just causes a local disease, and the farthest point it can reach is the inguinal lymph nodes. Other organisms that might cause painless genital ulcer include chlamydia trachomatis. This is causing lymphogranuloma venereum by biovars L1, L2, and L3, while biovars from D to K cause non-lymphogranuloma venereum genital infection, and you can review our video on the microbiology of chlamydia trachomatis. Treponema pallidum, which causes syphilis, is typically painless, and Klebsiella granulomatous, which causes granuloma inguinal, and again it's painless. Next question is, 27-year-old man who has recently immigrated from Nigeria, again this is Africa. He presents with penile ulcer. He didn't mention if it's painful or painless. He didn't mention dimensions. He didn't mention number. He didn't mention systemic affection as yet. So the ulcer initially started as a papule, then progressed to become painful ulcer. Okay, so I'm restricting my choices now to either herpes simplex or chancroid. It has an undermined ragged edge. Okay, here it goes with the chancroid, Haemophilus ducreyi. There is associated tender inguinal lymphadenopathy, and examination of the disease was unremarkable. What's the most likely diagnosis? We need to read the choices because in the end we might not find anything about chancroid. So chancroid's number one. This is my number one choice anyway. Lymphogranuloma venereum, typically not painful. Syphilis, typically not painful. Herpes simplex infection, okay, this might be painful. And the granuloma inguinal, this is painless. So my choices now are between chancroid and herpes simplex. I will go here for chancroid because the description of the ulcer was typical. Undermined ragged edge with a necrotic material. Okay, didn't mention necrotic material. Anyhow, this looks typically chancroid. And the answer is chancroid. So painful genital ulcers, again, herpes is more common than chancroid. And in painless genital ulcers, syphilis is more common than lymphogranuloma venereum. So as we mentioned, diagnosis of chancroid is more likely as the ulcer is painful and the typical description or depiction of the ulcer. Herpes simplex is obviously more common. The description of the ulcer is very characteristic of chancroid. There is painful inguinal lymphadenopathy and it's present in 50% of patients. In fact, we have noticed that in both questions, the patient came from Africa and Nigeria, and the other gentleman had an African tour. This is because sexual transmission of chancroid is very rare in the USA. For example, only 3 patients, 3 confirmed cases per year are reported. So we need an African tour or an African origin of the infection.